Diabetes is a growing problem, affecting millions of people in the US alone. It's a problem for patients, doctors, and you might not realize it, but diabetes is a problem for you too. See, a patient with diabetes costs double a patient without diabetes. And the worse the diabetes, the higher the cost. In fact, the disease accounts for 20% of all healthcare dollars spent, which reached $450 billion in 2016. Of that, more than $100 billion was wasted on hospitalizations and complications, which could have been avoided if patients could just get their blood sugars under control. Most cases of diabetes can be controlled with diet, lifestyle, and oral medications. But the most severe cases, the hardest to control, require injections of insulin. Insulin is complicated and downright scary. If a patient takes too little, their blood sugar stays high, which over time can lead to severe complications like stroke, heart attack, amputation, vision loss, and kidney damage. On the other hand, taking too much insulin can be fatal. And the worst part is that the right dose changes, depending on the time of day, current sugar level, and what food they're about to eat. All of this makes it difficult for a patient to manage their diabetes, which becomes costly for them and you. That's why we made DoseDr. We get people to target A1Cs faster and safer than any other intervention. We make diabetes easier on patients with our smartphone app. When it's time, the app reminds them to check their sugar. They enter their blood glucose level, and the app tells them in real time how much insulin to take. It's that simple. The patient knows what to do right then and there, which greatly increases medication adherence. It's as if their doctor was right there next to them. Physicians can then access our web-based portal to see updated patient data on their own time. Glucose values and insulin entries update in real time and are clearly displayed in a way a physician expects to see it. The portal also allows doctors to make adjustments to the patient's regimen, which is then communicated to the patient by the app. But where we really add value for the healthcare system is with our DoseDr physicians. A typical doctor sees 20 to 30 patients each day, not to mention documentation and billing. Rather than ask an overworked physician to do more tasks for their patients online, our DoseDr physicians offer primary care providers a hands-off solution. The DoseDr adds to the existing chronic care team and is there to monitor levels, titrate insulin doses, offer diet and lifestyle coaching, and authorize refills. By managing the patient between clinic visits, our DoseDr physicians improve patient care without adding extra work for anyone. Small, frequent titrations in the insulin dose between clinic visits allow for faster control of the blood sugar without overdoing it. And that's how we moved the A1C from 9.6 to 6.4 in just 3 months. The DoseDr approach eases the burden of diabetes management from network physicians and allows you to better manage your patient population. Improve the quality of your patients' lives, cut costs for payers and patients, and increase overall health. DoseDr.